welcome back to The Four, everyone. A Michigan physician is on the cutting edge of new technology, providing a state-of-the-art robotic surgery techniques for knee replacement patients, and stands as a leader in developing minimally invasive surgery. This is awesome, and I'm so glad, or so happy I got to talk to him.
Yeah, I cannot wait to see what this looks like. Michael got the chance to speak with Dr. Jeffrey DeClaire and his journey as the founder of the Michigan Knee Institute and the creator of the Elite Knee. Check it out.
And welcome back, everyone. There are more than 202 million people worldwide wearing smartwatches. And besides being used for playing music and tracking social media, smartphones are now monitoring your health. In fact, I use it quite a bit when I sleep and just overall well-being of myself. But in fact, a physician in Rochester Hills who's on the cutting edge of new technology, which we talk about in length here at The Four, is one of the first in the country to use them to track a patient's activity level after knee replacement. Here to tell us more is Dr. Jeffrey DeClaire, orthopedic knee specialist and founder of the Michigan Knee Institute. And later you'll hear from his patient, Denise Erhart from Petoskey, Michigan. Welcome, Jeff. Thank you so much for being here and talking to me about this brand new technology.
Yes, thank you for having me here. I appreciate it.
So let's talk about how we're using the smartwatch technology, because it just blows my mind. You know, technology is advancing so quickly, but then you hear stories of this, kind of like an AI knee, if you will. But tell me, how are you using smartwatch technology in your advancements in medical?
So smartwatches and smartphones have been around for a while. We use them for a variety of different things, primarily to track our exercise activity, step counts and things like that. So this was really started with a collaboration between the Apple company and Zimmer Corporation to develop a smartwatch application so that we could use it to track and monitor patient outcomes, as well as to try to create a connection or communication with the patient that's used preoperatively and postoperatively. So it started with an initial and an ongoing clinical study that we have going to utilize this in a group of patients. This is going to be one of the largest orthopedic studies. Our goal is to have close to 10,000 patients enrolled. It started in 2018. It's now being used universally for all our patients, but it's a combination of your smartphone and your smartwatch that can do several things. First of which is to be able to communicate directly with the patient on a live or real-time basis every day. There's educational and an exercise modules that they start preoperatively, so we can track metrics. So it measures step count, stand time, flights of stairs, right, and speed of walking, also heart rate. So we take these metrics preoperatively, and then we combine it with what we do intraoperatively, which gets into the utilization of even additional technology of robotics and what we call computer navigation. So I've been utilizing a method of surgery in the operating room, and again, we're capturing data. This is with the Korn Corporation, where we can now actually accurately position the implant to balance ligaments within a 0.5 millimeter, which is allowed for a very predictable positioning of the implant. This data is also stored on a cloud base. And then we use the smartphone and the Apple Watch postoperatively to assess their progress. So it's educational, the ability to communicate, and a way to track additional data points. And this has allowed us to create a database now that we can track kind of the outcomes of patients. And looking at large number of patients across the U.S., we're able to tell patients, you're right on track or you're falling below where it should be, which gives us that real-time data so we can interact and stay connected with the patient on a daily basis.
I mean, that's so cool because, who doesn't have one of these or, one of these nowadays? It seems like everyone has it as one way of keeping track of everything, whether it's sleep or, like you mentioned, steps. And it just makes sense to go hand in hand with a knee replacement. Let's see how it's doing. So can you tell me, Dr. DeClaire, what are you finding when you're using these?
Yeah, what we're finding initially, the study was launched to see if we can do preoperative and postoperative rehabilitation without the use of formal physical therapy. And so what we find is, and not all patients fit into that that sort of category, but it's an adjunct. It's something they can do on a daily basis. If you think about physical therapy, you're going to the physical therapist maybe twice a week or 3 times a week, but your therapy is really daily. And so this allows them to have educational videos, instructional videos, so they're actually participating and engaging in that recovery on a daily basis. The other thing that we've seen is the patient engagement. Typically post-op visits might be at the 2-week mark, 6-week, 3 months. And in between that, the patient's kind of out there wondering am I doing okay? This technology allows them through this, the Apple Watch and their smartphone to communicate with us with texting, video messaging, photo, which is all HIPAA compliant. And we, on the other hand, are tracking these metrics. So we can tell if somebody's not walking as fast as they should be at that point. We can intervene at any point in time, as well as with the patient. So we have found that it's decreased the number of physical therapy visits, and in some patients completely substituted for physical therapy with no change in outcome. In fact, in some patient populations, we see it's even better. And obviously, the other thing that we've seen is this patient satisfaction with the patient engagement.
Right. Is it now kind of a side question for you? Can it also tell you, like, say if something went wrong, does it tell you right away? It's like, hey, something's wrong here in the knee. They need to get somewhere.
Yeah, it can tell us that the patient's not really progressing in the predictable manner. And this is where we have these, what we call recovery curves. We have the data to see as far as like step counts. How many step counts are patients doing, and how does that increase relative to their pre-op status? And where should they be at 3 weeks, 6 weeks, 12 weeks? So if a patient's not meeting that expectation, we can pick up the phone or text them and say, how are things going, and vice versa. The other thing, when we combine this with computer technology in the operating room and the ability now to position implants very accurately to restore normal knee balance and stability, that we correlate the preoperative data with what we do in the operating room and then the postoperative outcomes, which allows now for a very predictable sort of plan of treatment using the data to help educate and execute the things that we want to do to achieve the goals with knee surgery.
Yeah, I was just going to say that it kind of gives you a blueprint of what they've been going through, if you will, kind of a map of what they've been experiencing. Whereas one day they might not have nearly as much steps as before. Be like, were you in pain here? Why the day that you didn't have as many steps, or something along those lines? And it's a great tool because you can see the past, if you will. Whereas before you can't see it nearly as clear. So it's a great tool to have. How has this form of communication made a big difference for patients?
Yeah, so I think the biggest thing, and I always say as the surgeon, as my patient surgeon, I'm available every day, 7 days a week, and that's the goal or the ideal. And so as a patient, you want to be able to access either me as your surgeon or my team so that you can have your questions answered and know that things are progressing in the right direction. And so that's I think one of the key things is the patient engagement. They have literally access, 24 hours a day, real time to me or my team. And then the other part is the modules on the app on their smartphone are educational, and they're also instructional on their exercise or rehabilitation program. And the educational part of it is a really big part, which starts preoperatively. So we know and they know exactly what to expect, what to do, because everybody, you want to do the right things at each step of the way and know that you're meeting the goals. And that's I think the real thing that we're seeing with our patients. It's really been sort of a real luxury, again, as a surgeon, to be able to have that constant interaction with them.
It's very cool to know that the technology, you're getting it for your knee, keeping track of everything, but at the same time, you're implementing that education and information part of it, because that's a huge part of it. You know, a lot of people just back in the day got a knee replacement and that was it. There's not much more to it. But nowadays with technology, it just seems like we are so in depth with everything. There's a lot of learning and a lot of information that you're getting and keeping you aware of everything that is happening. Especially we need that. We need that 100%. So I appreciate it, Jeff. Thank you so much for sitting down with me. Dr. Jeff DeClaire, orthopedic knee specialist and founder of the Michigan Knee Institute, pioneer in robotic knee replacement surgery. I love the fact that you're taking this technology and replacing it in the human body so we can keep ourselves informed. Jeffrey, I appreciate you being here and really giving us the information, insight of this new technology. And if anyone out there needs more information on Dr. Jeffrey DeClaire or what he does, or this AI knee, if you will, you can find all the information on 910news.com. Thank you, Jeff.
Thank you very much for having me.